So a popular question would be, obviously, if you're not available, and you said there are other doctors
Right.
available, but how would we go about, say if we had a question outside of an appointment, how would we reach you?
It depends on what time that question is. So during the day, you call and you leave a message with the office, and then it would come to me in the office. There's also email. Facey has a portal. It's all a secure site. So you log on to the portal. You have to set up an account. So you log on to the portal, and then you can email me as well. Those are for non-urgent issues. So those are pretty much for, your daily phone call type things. At nighttime, something happens at night, your child has a fever or something like you call. Depending on the area that you're in, here there's 4 of us who take call, pediatricians. So there's Dr. Cowan and myself here, and then there's 2 pediatricians in our Tarzana office, and so the 4 of us share call. So you call, and then one of us, it'd reach kind of an exchange, and then we get paged with the phone call, and then we call you back. You should get a phone call back within 15 minutes.
Okay.
So
for
that's
instance, with that said, God forbid something happens to our kid, Alex, that maybe she falls, breaks her leg, or what do we do in a sense of, other than going straight to an emergency center or something?
Well, you probably call me on the way if she broke her leg or not. Just saying, I think she broke her leg. I'd say, okay, keep going.
Yeah.
So then, you would go, and then what would happen is, at that point, she would go to probably an emergency room or urgent care. They take the x-rays, say she does have a fracture. Then typically what happens is you call me the next day, or, and I get the x-ray report, and then I would say, okay, she has a fracture. I need to put in an urgent or stat off to the orthopedist. Now, it gets a little complicated depending on insurance. So depending on your insurance dictates how that gets done. So depending on, you can either call this person, and we have some amazing people within the Facey organization and contracted specialists in the area that are in the area. Well, for peds it's a little different because the pediatric specialists are usually by pediatric hospitals. So sometimes, but we have some great specialists that we refer people to. So depending on your insurance dictates how that happens. I either give you the phone number and you can call yourself, or we have to put in an authorization. But there are people who at Facey who are literally, we call and they can do it on the spot. Gotcha. And then sometimes we can even call and get the appointment for you, depending on, call the specialist for you and schedule the appointment, especially for like a fracture. If I know that something's broken, I'll call the orthopedist and say, okay, Alex has a fracture. What time can you get her in? And they're usually really good at that.
Gotcha.
Does Facey have a lot of different specialties covered within the group?
I think they have everything covered.
Yeah.
Maybe not within Facey itself, but between the contracted specialists, yes.
Okay.
We're, from pediatric standpoint, we're contracted. Most of our patients, because it's Providence, for most things can be seen at Tarzana.
Okay.
And honestly, the Children's Hospital physicians are now running Tarzana, so it's really just kind of an annex, almost.
Gotcha.
It's just easier and closer. But contracted with Children's, Tarzana, Holy Cross up in Mission Hills, and some people go to Henry Mayo. So there's pretty much all the hospitals in the area, and all the many of the specialists there.
That's great. So Alex would be covered. Anything that goes down,
anything that would go down, Alex would be covered.
Awesome.
Well, you spoke on, depending on your situation on insurance and things like that, where you would send them. How, as somebody who's a new patient or family looking for a pediatric care, how would they go about, what does Facey accept in terms of insurance and things like that for people who are looking?
They accept, or we accept, the organization, a lot of insurances. There's so many now, I couldn't possibly tell you exactly which ones, because there's so many different varieties, even amongst the individual insurance company. There's all different subsets of that. So I always say check with either the front desk or, the main line at Facey, because I can't possibly keep track of them anymore like we used to.
Yeah.
But a lot.
Okay.
A lot of, I would say most, but not all. So that's why I say always check.
Okay.